Hello, everyone. Welcome back to Neurospicy Nursing. We are going to be going over Croup in this 5 slide fix today, where I teach you about a certain topic in 5 slides or less. Let's get on into it. All right, so what is Croup? Croup is a very, very, very scary thing that parents can go through. Um, it can actually be bacterial or viral. And it's gonna be like one of the hallmark things, right, is inflammation of the larynx, trachea, and the bronchi. They have a classic cough that sounds very barky. I kind of feel like it sounds like a seal going like oof, oof, oof. That sounds so goofy. I'm so sorry. If you guys have headphones on, you probably got a good giggle out of that. But that's what it really sounds like to me. If if you sound like a seal, you probably have croup. But classic hallmark symptoms, that barky cough, sealy cough, however you want to say it, hoarseness, and then they will also tend to have an inspiratory, keyword inspiratory stridor. Very common in 6 months to 3 years. And because we talked about it in the last video, kids are not tiny adults. They have smaller airways and a higher obstruction risk. So this is a little slide about the difference between viral and bacterial croup. So let's just get on into it. So acute larotracheal bronchitis. I try my best, guys. Its hallmark signs are a low-grade fever, that barky, brassy cough, stridor, and then retraction. So it doesn't matter if it's substernal, intercostal, or clavicle area. They will still have um, retractions. If you watched the last video before you watched this one and you remember me talking about um a certain person on the internet, go ahead and comment that below. Or if you're one of my students, send me a text with like a little haha, I can't believe you mentioned them. Um, if you know who I'm talking about. If you don't, then don't do that. But if you do, then let me know. All right. And then spasmodic, I want you to kind of think of it like it's a spasm of the airway because that's basically what it is. And it's gonna occur at nighttime. And then when they wake up in the morning, they're pretty much completely fine. But at night, they'll have those crazy sudden attacks of that barky, brassy cough. And then they feel fine. Both of these are kind of managed with humidified oxygen, um, epi, and steroids. The viral croup is very, very noisy, but it's usually fixable. It's not really like a life or death type of thing. You know what I mean? All right. So, epiglottitis. This one is in red because it's an emergency. No cough. They can't cough. They've got no air. Drooling. Why are they drooling? They can't breathe. Their airway is so swollen they can't swallow. Agitation. Why are they agitated? They can't breathe. They can't breathe. Cherry red epiglottitis. Okay. We are not inspecting the throat. Okay. Yes, cherry red epiglottitis is a sign of it, but we're not going to see it until after we need to intubate. Okay. Because if we go in and we try to inspect all of a sudden, it's just going to make things 100 times worse. And then stridor is going to be worse for them when they're supine. And then the last one is acute tracheitis, high fever, lots of secretions, and they are not going to respond to any of those viral comfort measures, okay? Biggest thing with croup, if they're tripoding, if they're drooling, we're not touching them unless we're ready to intubate. We're not going to inspect anything. We're getting ready to intubate. We're calling a provider and we're getting some help. All right, red flags. When to panic. We talked about a little bit of them when we went over epiglottitis, but just to recap, increasing stridor, retractions, lethargy, cyanosis, drooling, difficulty swallowing, loss of consciousness, and pallor. Don't forget, stridor and a drool, always airway until proven otherwise. Nursing care. What we get to do, we're maintaining their airway, especially if it's epiglottitis, because they are crashing and they are crashing fast. We're going to give them humidified oxygen. It's going to help with those secretions. Epinephrine is going to help with that airway. If you guys remember from who knows when we went over epinephrine, it's a sympathomimetic, so it mimics the sympathetic nervous system. And so it helps open the airways. That's why we tend to use it in um, anaphylaxis. We're also going to give corticosteroids. That's going to help with the inflammation. We're going to hydrate them. Hydration also helps thin out those secretions. We're going to keep them calm because if we agitate them more, they're just not going to be able to breathe. And we're going to give antibiotics only if it's bacterial. Remember, in nursing, airway, breathing, circulation. Airway is first, everything else is going to be second because if their airway goes out, they're going out. All right, resources. Here they go. And that's all I have for you guys. Thank you so much. And I will see you in the next lecture for cystic fibrosis. Thanks, guys. Bye.